Hey everybody, this is Dr. Hinson. I wanted to make a video today that talks a little bit about digestion. We had mentioned in a previous video that a lot of times when people complain of digestive issues, the stomach, for example, is what we're going to talk about today. When they complain about those digestive issues, we utilize applied kinesiology techniques to kind of assess an individual and figure out why that is. Is it their small intestine? Is it their stomach? Is it the liver, gallbladder, whatever it could be, pancreas? Any of those organs can affect digestion, but there's a really big concept that I really want to get across today, which is super important, and that is that when we are mentally and emotionally stressed out, with the holidays coming up, families may be coming in to visit, maybe you got a Christmas list and you're trying to work and the demands on your time get very compromised. Stress decreases stomach acid. I'm going to say that one more time. When we are mentally and emotionally stressed out, stomach acid levels decrease. So when you watch TV and you see everyone talking about acid reflux and why you need to take Prilosec or some of these other antacid medications out there on the market that you can get over the counter, a lot of times you're probably doing yourself more harm than good. And the reason is because obviously stomach acid protects us from a lot of the negative things that could be in our food. Viruses, parasites, bacteria, fungus, different things like that gets eaten up by the acid if we have really good stomach function, and prevents those things from getting into our system and causing a bunch of problems. So, a lot of times when people are coming into the office and they're complaining of acid reflux and other digestive disorders, there's a couple of things I check. And so utilizing applied kinesiology techniques, one of the muscles associated with the stomach is underneath the collarbone on either side. It's one of the pec muscles, or the pectoralis major clavicular muscle here. Also, the muscles of the forearm, the wrist, as well as the biceps muscles in our arm, those are all stomach related as well. So a person could be dealing with a stomach issue and experience pain in one or more of those areas. So a couple of things I want to explain to you about the stomach. 80% of our digestion occurs there, and mental and emotional stress obviously can impair stomach function like we mentioned. So, what do you do about it? And I many times will come in and test different muscles associated with stomach function, and then based on other tests that we do in the office, we try to determine, okay, is this person producing enough acid to be able to properly digest their food? If so, perhaps there is just some stress on the nerves that control stomach function. So for example, people ask, well, what do I need to adjust, for the stomach? A lot of times when people have digestive complaints, they may complain of tightness at the base of their skull. They may even get headaches at the base of their skull. And so I always try to make sure these upper neck vertebrae are properly aligned, because the nerve supply to the stomach is influenced by this area. One other area, because I had a patient come in who complained of acid reflux, and she thought I was crazy when I told her I needed to adjust a bone in her foot and ankle in order to improve her stomach function. So if you can see this chart behind me, we're going to try to bring this over and show you. The acupuncture meridians run all throughout the body, and we usually have, we have these on both sides of our body. But if you look here at the stomach meridian actually comes all the way up in here through the TMJ, all the way down through the ankle. And one of the bones in the ankle here has an influence on the stomach acupuncture meridian. So it's very common for me when I'm dealing with someone that has stomach as a primary cause of some of their digestive issues to have to manipulate one or both of the ankles here in an attempt to improve not only the acupuncture meridian of the stomach, but improving the stomach function itself. So a lot of times I explain to people that, there may be certain nutrients an individual needs. Since emotions decrease stomach acid, there may be different emotional techniques that we have to do. So one of the biggest things you can do, even to help with your allergies, if you're dealing with allergies, is improving stomach function and improving your stomach's ability to digest food. So it may require making different adjustments to the body in order to help improve that. But another thing I'm seeing quite a bit are what we call hiatal hernia, which is that area just below your breastbone that can sometimes get really tight and tender. That has a major effect on stomach function. And that can also be a big cause of esophageal reflux, or GERD, as it's sometimes called. And so fixing hiatal hernias, improving the digestive enzyme production in the stomach, fixing emotions, because there's different techniques we use to be able to reset emotions in the body so that the emotions aren't causing a negative impact on the body and on the stomach function. So if you have any further questions about this, feel free to message me and ask away. I'll be happy to give you some more information on that. But in the meantime, make sure your stomach's working good, and a lot of other things in your life will improve. Talk to you guys next time.